Today, we're diving deep into a high-stakes medical emergency. We're going to unpack how an ancient secret, now backed by the very latest 2025 clinical guidelines, can unlock peak performance when a life is literally hanging in the balance. So, let me ask you this. We all blame outside forces when we fail, right? But what if the real fight, the real barrier to success, is actually happening inside our own heads, especially when the pressure is really on? The scene is set. It's that time of night. You know the one. The hospital is quiet, but that's exactly when things can get the most intense. And the situation is about as critical as it gets. A 45-year-old Morn is in respiratory arrest, and it's quickly spiraling into a full-blown cardiac arrest. Every single second counts here. Meet Dr. Purva. She is brilliant, highly trained, and technically she knows exactly what to do. But she has just failed to secure the patient's airway, a procedure called intubation, not once, but twice. You can just imagine it. Her hands are shaking, her mind is racing, and the patient's oxygen level has plummeted to a terrifying 22%. So this is the moment her mentor, Dr. SB, steps in. He sees right away that the problem isn't a lack of knowledge, it's panic. So he pulls her aside, not to chew her out, but to teach her what might be the single most important lesson of her entire career. And out in the hallway, Dr. SB doesn't talk about medical technique at all. Nope. Instead, he shares a core teaching from the ancient Indian text, the Bhagavad Gita. He calls it the supreme secret of mastery. And this is it. This is the secret. Now, this isn't really about religion, it's about psychology. It's this idea of performing an action with total, complete absorption, getting your ego and your anxiety out of the way. It's like the action itself is a sacred offering. You're devoted to the craft, not to your own success or failure. In modern psychology, we have a name for this. It's called a flow state. You've probably felt it before. It's that feeling of being totally in the zone. Time kind of slows down and your skills just take over. See, Dr. Purva's anxiety and her intense fear of failing were the very things blocking her from getting into that state. Dr. SB explains that mastery isn't just about doing something over and over. It's about a progression of consciousness. You start as a beginner, right? Everything's mechanical, clunky. Then you become competent. It's smoother, but you're still thinking through every step. But a master enters a flow state where the technique just happens through them, not by them. It's effortless. Okay, and here's where this all gets really fascinating. This ancient philosophy lines up perfectly with the most current, evidence-based medical guidelines. Let's take a look at the 2025 ACLS standards for managing an airway. This is a massive shift in thinking. The old way, which was kind of ego-driven, was to always go for the most difficult procedure, the intubation. But the new guidelines, they reflect this more present, more thoughtful approach. Do what's best and safest for the patient in this moment, which is often something much simpler. It's the Gita's teaching in action. Get your ego out of the way. And the reason for this change is so clear when you look at the options. There isn't one best tool. There's only the right tool for the situation and for the provider's skill level. A true master knows when to use a simple bag mask instead of risking a tricky intubation that could interrupt life-saving CPR. And when that advanced airway is finally in place, precision is absolutely everything. The guideline is one single breath every 6 seconds. That's exactly 10 breaths per minute. A super common mistake is hyperventilation, giving way too many breaths, which actually hurts the patient by reducing blood flow to the heart. See? Mastery is in the details. And this right here is the most critical rule of all. You absolutely must, objectively, confirm that the tube is in the right place. Putting that tube in the esophagus instead of the trachea is a fatal mistake. And waveform capnography, that's a monitor measuring the CO2 in a patient's breath, is the mandatory non-negotiable proof. It's about data over confidence, every single time. All right, so, armed with this powerful new mindset, Dr. Purva walks back to the patient for her third attempt. But this time, everything is different. First, she doesn't rush in. She consciously just pauses. She breaks that vicious cycle of panic that had her in its grip. Then she takes one single centering breath. It calms her nervous system and brings her mind into sharp, clear focus. For just a split second, she mentally rehearses the procedure. She sees herself succeeding, calmly and clearly. And now her movements are fluid, confident, precise. She uses the laryngoscope, visualizes the vocal cords, and passes the tube smoothly. She's in flow. And immediately, the monitor flashes a perfect capnography waveform. The tube is in. The confirmation is objective. It's instant. Success. Later, when she thought about what changed, she knew it wasn't her technical skill. It was her mental state. By focusing on the task as an offering to the patient, instead of a test of her own abilities, she allowed her true skill to finally come through. You know, Dr. Priva's story isn't just about medicine. It's about a universal path to mastering any complex skill, and it's a choice that every single one of us can make. So here's the roadmap. It's not just about mindless repetition. It's deliberate practice, focusing on your weak spots. It requires mental training, like visualization and mindfulness, to find that presence. It demands honest self-assessment, knowing your limits and when to ask for help. And crucially, it's about choosing the right action for the situation, not the one that makes your ego feel good. Ultimately, the supreme secret is really this. Mastery isn't some destination you arrive at. It's a state of complete presence that you choose to live in while you're doing the work. It's a devotion to the craft itself. So the question for all of us is, where in our own lives can we stop trying so hard to prove ourselves and just be present enough to do the work?